Hello, my name is Jan Mold. I'm one of the assistant directors for HOSA Future Health Professionals. It's my pleasure to share with you today some information on the endocrine system and diabetes. If you're interested in taking the pathophysiology exam that HOSA offers, I'd suggest you go to HOSA.org and look at the guidelines. The information that's included in this presentation would be perfect for that event.
What exactly is a hormone? This video will cover some of the most important ones and how they keep you healthy. Estrogen, the female sex hormone, sets off puberty, regulates your menstrual cycle, maintains pregnancy, and keeps bones strong for women and men too. Watch out, world! Testosterone, the male sex hormone, contributes to your sex drive, bone density, and muscle strength in both men and women. It's what makes women swoon over George Clooney. Growth hormone. As its name implies, it promotes human growth and plays a crucial role in increasing muscle mass and bone development, protecting our tissues from breaking down to avoid injury. If we didn't have this, we'd all still be baby-sized. Oxytocin, dubbed the love hormone. Oxytocin levels rise when we make physical contact with another human. It's also released during childbirth and helps with milk letdown during lactation. Follicle stimulating hormone. In women, FSH helps control the estradiol hormone synthesis, menstrual cycling, and the production of eggs by the ovaries. In men, it helps control the production of sperm. Isn't that stimulating? Progesterone. After ovulation, progesterone rises to prepare your uterus for the implantation of the embryo. If pregnancy doesn't occur, the levels drop again, causing you to get your period, and PMS, sadly. Human chorionic gonadotropin, HCG, is the hormone that a pregnancy test can detect about 2 weeks after conception, unless you start craving pickles and ice cream first. Prolactin. The pituitary gland releases prolactin after childbirth to trigger lactation, which enables moms to breastfeed. Gives new meaning to the term. Got milk? Luteinizing hormone. LH controls the production of estrogen or testosterone from the ovaries or testes and is often measured during an infertility workup to evaluate ovulation in women or testicular function in men. Melatonin. Insomniacs may feel too familiar with this sleep hormone, which regulates our sleep and wake cycles. Peptide YY. PYY is produced in the small intestine and released into your bloodstream after you eat to decrease appetite and make you feel full. Glucagon, like peptide 1. GLP-1 is the appetite regulating hormone produced in the gut after eating. Leptin. This hormone controls appetite by signaling your brain to stop eating. It also helps your brain regulate how much energy your body burns throughout the day, like having a personal trainer in your brain. Thyroid hormones, known as T3 and T4. These hormones dictate your weight, determine your energy levels, internal temperature, skin, hair, nail growth, and more. Insulin. After you eat, cells in your pancreas release insulin that shuttles glucose from your bloodstream into your body's tissues to use for energy later. Kind of like little energy minions. Glucagon. Produced by cells in your pancreas and works to keep your blood sugar levels stable. This hormone breaks down stored glucose so your body can use it for energy. Serotonin. Boosts and stabilizes mood. Dark chocolate converts a compound called L-tryptophan to serotonin, which kind of explains why chocolate makes us happy. Cortisol. Released during times of stress, increasing heart rate, blood pressure, blood glucose, respiration, and muscle tension in response. It also temporarily shuts down the body's systems that aren't needed when you're being chased by a bear, such as digestion and reproduction. Adrenaline. The flight or fight hormone allows you to battle a danger head on or escape to safety, away from that bear. DHEA. This hormone from the adrenal gland and ovaries initiates production of male and female sex hormones. Parathyroid hormone. PTH is vital to our bone health and essential for normal calcium and phosphorus balance in the body. Ghrelin stimulates appetite and prepares the body for food, like an inner grandma going, "You should eat." Aldosterone regulates blood pressure by increasing salt and water reabsorption in the kidney. Visit hormone.org to download the essential guide to your hormones to find out more about keeping your hormones in balance.
So the endocrine system, a lot of different hormones that are released, a very complicated system. But I want to focus specifically on diabetes today.
Diabetes is a disease in which glucose, or sugar levels, are above normal in the blood. Most of the food we eat is turned into glucose that our bodies use for energy. The pancreas, an organ that lies near the stomach, makes a hormone called insulin that helps glucose get into the cells of our bodies. When you have diabetes, your body doesn't make enough insulin, or it can't use its own insulin as well as it should. This causes glucose to build up in your blood. There are several types of diabetes. In type 1 diabetes, the body does not make insulin. In type 2 diabetes, the body does not use insulin well and may not make enough insulin. This is the most common form of diabetes. Gestational diabetes happens when a woman's body does not use insulin well while she is pregnant. It raises her risk for type 2 diabetes and raises her child's risk of getting diabetes. Diabetes is serious. Over time, high blood glucose levels may cause many health problems, including heart disease, blindness, kidney failure, and foot sores and amputations.
So let's talk about diabetes. Diabetes is defined as a disease in which the level of glucose in the blood is too high. Like the video told you, insulin is a hormone that's produced in the pancreas by the Isle of Langerhans. Insulin allows sugar to be used by cells as energy. A normal blood sugar should range between 70 and 99. They did talk about the 3 types of diabetes, and I want to go back over those to make sure we're understanding. Type 1 diabetics, their body does not make insulin. Type 2, body does not make enough, or it does not use the insulin well. And then gestational diabetes occurs when the woman is pregnant. Pregnancy puts an enormous amount of stress on the female's body. The incidence of gestational diabetes is 7 in 100 pregnancies. Normally it resolves after delivery. So the 3 different types, type 1, type 2, and gestational diabetes. It's estimated that folks in the United States, 1 in 10 are diabetic, either type 1 or type 2. There are what are called cardinal symptoms. And when you talk about cardinal symptoms, those symptoms should lead you to think about a diagnosis. And the three cardinal symptoms for diagnosis of diabetes are the poly. And if you'll remember back to your medical terminology, poly means many or much. And the three polys are polyphagia, polydipsia, and polyuria. Polyphagia, increased hunger. Polydipsia, increased thirst. And polyuria, increased urination. Quite frequently, classroom teachers may contact parents and say, your child's always thirsty, they're frequently asking to go to the bathroom. Those two things would make it important for them to have follow-up. You might also see weight loss, fatigue, blurry vision, or slow healing wounds, bruises, or sores. A diagnosis is made with a fasting blood sugar, and usually that's with not have eaten within the last 8 hours. A level of 120 or higher for your blood glucose levels on 2 readings will lead to a diagnosis of diabetes. If the levels between 100 to 119 on a fasting blood sugar, and you'll see that abbreviated FBS, then those people are termed pre-diabetic. It's estimated in the United States 1 in 3 are pre-diabetic. Knowing your status, knowing that you're pre-diabetic is extremely important because oftentimes diet and exercise can prevent the person from becoming diabetic. You also may hear somebody have an oral glucose tolerance test or a GTT ordered, and this is often done during pregnancy. What happens with this is that the person is given a beverage that is extremely sweet, 75 grams of sugar, and 2 hours after they ingest the liquid, if their level is greater than 200, that means that their body has been unable to produce the insulin required to pull that level back down. There are also A1C tests that gives an overall glucose level for the last several months. And that is frequently what physicians will look at because it is extremely important. The more they learn about diabetes, the more they know that a normal glucose level is going to decrease your risk for complications. Most of us know that when somebody's diagnosed with diabetes, they're going to end up with some diet restrictions and some important rules about their diet. They should eat 3 meals a day about the same time to keep their levels steady. And this is going to be extremely difficult for your younger patients. Oftentimes, particularly in elementary school, they'll be eating such early lunches that when they first start school, it may be that they're eating lunch at the time they would have normally eaten breakfast. So oftentimes you're going to see a lot of bouncing around with their blood sugar levels. They also need to eat plenty of fiber. They need to eat fewer of the foods that are high in sugar and fat. Those are called empty calories, as is alcohol, in that you get no nutritional benefit from those empty calorie foods. Particularly with type 2 diabetes, if a patient is overweight, a loss of even 5 to 10 pounds can decrease their blood sugar. Exercise helps the body use insulin and lowers a person's blood sugar. So diet and exercise for those pre-diabetics may keep them from becoming diabetic. For your type 1 diabetic, they do not produce insulin, so they will be given insulin. Insulin cannot be given by mouth because it's broken down in the stomach. It has to be given by injection. Type 2 diabetics may be on an oral hypoglycemic agent or pills. Some type 2 diabetics do end up needing insulin. But again, type 1 diabetics will always take injectable insulin. For your younger folks, that's going to be really difficult. Most of us did not go in when we were young and say, give me a shot every time you went to the doctor's office. In fact, most of us were afraid of that. These folks are learning that they're going to have to inject themselves daily. Along with their medication, it's going to be important that they check their blood sugar. Again, can't stress enough that normal blood sugar levels are going to prevent complications.
Many of my patients are hesitant to begin injecting insulin, but once they actually try it, it becomes like any other routine. Here's how I teach them. You'll need your bottle of insulin, syringe, and a sharps container. Always wash your hands with soap and water before you begin. Typically, there are 3 syringe sizes. 1 cc holds 100 units of insulin, a half cc holds 50 units, and a third cc holds 30 units. Talk to your care team about how much insulin you need and which syringe size you should use. Insulin needles have gotten much smaller over the years, so they are much less painful than you might expect. When you first get your insulin, keep it refrigerated. After the first time you use it, you can keep it in room temperature for 28 to 42 days. It will be more comfortable to inject. If you have cloudy insulin, it needs to be mixed. Gently roll the bottle in your hands, then rotate it from top to bottom without shaking. When you're ready to inject, pull the plunger back to the number of units needed, drawing air into the syringe. Insert the needle into the bottle of the insulin through the rubber cap. Inject the air from the syringe into the bottle. Turn the bottle upside down with the needle in it. Make sure the tip of the needle is fully submerged in the insulin as you pull the plunger back to the correct number of insulin units. This helps prevent air bubbles. Air bubbles aren't harmful, but can take up room and prevent you from getting the right dose. If you have bubbles, simply inject the contents back into the bottle and repeat the procedure. Next, inject at a 90-degree angle. Hold for 5 seconds, then pull the needle out. Drop the syringe into the sharps container, which you can buy at any local pharmacy. Ask your diabetes care manager where to safely dispose of your sharps container when it's full. Make sure not to reuse insulin needles as it's not safe and can cause more pain with injection. It's important to switch injection sites to prevent bruising and pain. Each time you inject, choose a new site this way. Rotate injection sites in an imaginary circle. Always leave 2 fingers width in between injection sites and keep the same distance from your belly button. Your care team prescribes insulin because it's safe and effective. We're confident you will be able to use it successfully. If you have any questions about how to inject insulin or how much to take, ask your care manager. Adjusting to a new habit can be challenging at first, but the benefits to your health are worth it.
Okay, so not only are you going to be injecting, and they showed the stomach, there are other places, the legs and arm, that you can give the injections, but it's extremely important that you do rotate the sites. And one of the things I found when I worked on the adolescent unit is the stomach was the least used. And most of the kids hated when I was on duty because I would insist that they gave it in the stomach because they're a little hesitant to do that. If you don't rotate sites, you will develop complications where there will be hardened areas and you'll lose that site. You're also, diabetics are going to be using a glucometer.
Hi, my name's Katie Brosnan. I'm a registered nurse here in Austin, Texas, and today I'm going to tell you how to use a glucometer. So we're going to talk about the most commonly used glucometers that are at home. There's a couple of components that they all have, and I'm just going to kind of walk through those. So what you want to do is have all of your supplies ready. If you are getting a new bottle of test strips, you want to make sure that your monitor is coded with the code on the test strips. So that's important to do when you turn your monitor on. You're going to take the lancet, which has the needle in it, insert it into the plunger, and you're going to adjust the height of what you prefer for when the height that the needle is going to hit your skin, piercing the skin and drawing the blood. So you're going to first you're going to wipe off your finger with alcohol, use the plunger, and you're going to draw blood with that. Then you're going to wipe away the first drop of blood, and you're going to gently squeeze the finger again. Using the test strip that you have already made sure matched with the monitor, that it's reading it correctly, that's already inserted into your monitor, you're going to put the droplet of blood into the correct place on that little test strip. Then you're going to wait. The test strip is going to be read by the monitor, and it's going to deliver the information, or it's going to deliver your blood sugar levels. And that's the basic way to use a glucometer at home.
So it doesn't look difficult, but for a lot of our patients, it's going to be extremely difficult to learn how to stick themselves, but extremely important. Okay, let's talk about hypoglycemia, because this can be a true medical emergency for your diabetic patients. Going back to medical terminology, hypo, below, glyc, sugar, emia, in the blood. So low blood sugar. This can occur when the patient eats less than usual, they miss a meal or snack, they're more active than usual, or if they drink alcohol beverages on an empty stomach. And I want to share a clip with you. This is probably one of the best depictions I've seen of a hypoglycemic episode. This comes from Steel Magnolias and Julia Roberts.
Shelby, hold on. Clary's getting you some juice. Shelby, should I get her a cookie? No, juice is better.
Here's the juice.
Shelby, you need some juice. You need some juice.
Stop it, Mama.
Drink the juice. Please drink the juice.
No! Stop it, Mama. In my purse.
No, you didn't bring your purse, sweetheart. You didn't bring your purse. No, you didn't. No, here you go. Here you go. Drink some of this. It's not any wonder with all this running around and wet nonsense.
Excuse me, should I call the doctor or something?
No.
She's a diabetic.
She just has a little too much insulin, that's all. We just get a little more in it, she'll be all right.
Don't leave me alone. I'm gonna leave.
Oh, I'd love to see you try. Cooperate, please. Honey, drink, please. Come on now. There, girl. Yes. There you go. There. That's a start.
This one hit her fast.
She's been so upset lately.
Dr. Mitchell told her on her last appointment. Children aren't possible. Don't talk about me like I'm not here.
Oh, she's making some sense now. Yes, she is. This one was not bad at all. It was not bad at all.
Okay, so as you just watched, those symptoms of hypoglycemia are going to differ, and your patient probably is going to be able to tell you what triggers they recognize as hypoglycemic episodes. But if you have been really busy one day and forgot to eat, then you may know a little bit about the hypoglycemia, mild hypoglycemia. They'll be hungry, dizzy, nervous, shaky, sweaty, confused, anxious. Those are symptoms. Again, this can be a true medical emergency, can result in death if you don't get it resolved. So if you have a known diabetic who's demonstrating those symptoms or any similar symptoms, then you need to treat it immediately. If you can, you have them check a blood sugar. If you don't have time, then you can go ahead and start with giving them some form of sugar. If it's below 70, then we're hypoglycemic. So some people carry glucose tablets. I've had students bring those in at the first of the year, and we put them in the drawer for them. They may bring soft drinks for me to put in the refrigerator for them. It really depends on what they want. As long as they're conscious and able to take in, then I also keep mints in my office in case one of my diabetics went low. A lot of them, though, carry their own preference. And I had one student who carried, the icing that you write on a birthday cake with. That was his choice of sugar. And if you think about it, instant sugar. Once you give them that sugar substance, you're going to have them recheck their blood sugar level. And if it is in 15 minutes, and if it is below 70, then you're going to repeat again. Really important that you understand that hypoglycemia can be a medical emergency and needs to be treated as such. Let's talk a little bit about these complications because they can be extremely severe. Diabetic neuropathy is a result of decreased oxygen to the nerves, so there's not the message relay that we need. SX means symptoms, and the symptoms they're going to complain of is numbness, shooting pains, weakness, sores that heal slowly. Over half of your diabetics are going to experience some type of diabetic neuropathy. One of the things my clinical students saw, particularly when they were going to the Veterans Administration for their clinical experience, is a lot of amputees. And one of the things that they were very surprised to discover is most of the patients who were amputees, it was not a result of a war injury. It was a result of diabetes complications. So for these patients, foot care is going to be extremely important. You're going to recommend, and they're going to be followed by a podiatrist. Another complication is diabetic retinopathy. If you'll remember, PATH disease. So this is damage to the tiny blood vessels in the retina. The symptoms for this may be blurry or double vision, rings or dark spots, or pain or pressure in the eye. To prevent this complication from sneaking up on your diabetic patients, they're going to be recommended to have an eye exam every year. Kidney damage, they can have damage to the blood vessels that can lead to kidney failure. They need a protein albumin level yearly. It may be that they have to limit their protein if the damage to their kidneys is significant and the kidneys cannot handle the protein. They are at an increased risk for heart disease and stroke, so their blood pressure and cholesterol levels need to be monitored and to be maintained at a recommended level. You can understand why it's so important that they follow up with family doctors, podiatrists, ophthalmologists. There's a lot of complications that you want to try to prevent. Again, I just can't stress enough that research shows that the best method of prevention is keeping the blood sugar as normal as possible. I know that it's really easy for us to sit and you listen to a lecture on diabetes, but I really wanted to bring it home to you to close this presentation out with a production by the Juvenile Diabetes Research Foundation, and this is Living with Diabetes, Type 1.
Riley needs those skills. Don't take off of her. She's low. Give me a bite. Ready? Hold on. I'm going to take a big piece.
Wait, I want, give me a square. When I was diagnosed, I was 4 years old. I was diagnosed when I was 8 years old. When Jessie was diagnosed with type 1, I was really confused. I didn't really understand what was going on, but I knew that I would help her in any way I could.
2 teenagers with diabetes.
We're lucky that they're fairly responsible. they're not a whole lot different than our other teenagers. They ups and downs.
Living with type 1 diabetes is hard. It feels like I've been living with it forever. I don't really remember not having it, especially because Jessie was diagnosed first. I always remember counting and like weighing my food.
It's hard to be a teenager, and then you throw on an insulin pump and constant finger pokes and having to eat and all these things that teenage girls shouldn't have the pressure of having to do.
Living with diabetes is like living my life, I guess, because it is my life. My biggest challenge with living with type 1 diabetes would be that sometimes I feel like it defines me as a person.
The biggest challenge of having 2 children with type 1 diabetes is remembering that they're 2 different children.
As I coach them, I sometimes forget one is completely different than the other one. So how I would react to, say, Riley when she was playing ringette, being low, or if she was high, would be different than Jessie. Like, Jessie's personality is just give me some Skittles or some apple juice and I'm ready to go, right?
And then Riley's more conscientious.
Very, yeah. She would be, I ain't going anywhere. Like, she would yell at me on the bench, I ain't going out. So it was different. It was hard.
When I was diagnosed, something that really worried me is that now my parents have 2 kids to deal with that are diabetic rather than just one. And we were both young in that we couldn't really do any of it ourselves.
Whenever they're low, I get them a juice box, and I have to tell my parents what their blood sugar is.
My life has changed a lot. It's made me probably more responsible, but I don't know, I can't really remember. I can't forget about it. It's not something like all my other problems where I can just kind of forget about it for a couple hours. I have to always remember that I'm diabetic. I wish people would understand that it's not about, like, you don't get it from what you eat. It's not our fault. Oh, they're eating so much, they're going to be diabetic. That's not true. That's not what it is.
As a dad, I'm like, okay, I got to get my little superstar out there to play. And then she's low and she can't play. And you look at the bench and you see her and you know she's just upset and you can't. You want to just go over and hug her or something. She doesn't want that. She's just, get away. Like, leave me alone. You know, and you can't go fix her.
A cure to me would mean that A cure would mean everything. It would help me in so many different ways because this has been my life for so many years, and it would be so different because it would just be gone. It would just mean freedom. Freedom for them and for their brother. A cure to me would mean that I could live my life like a normal teenager and not have something to worry about when I already have all this stress from homework.
Freedom, but the ability to sleep in or to go out and be a quote-unquote regular person or a normal person or an average person, letting them just experience what I know and what we know is normal. If I was free of type 1 diabetes, the first thing I would do is probably go somewhere where I can be like athletic and do a bunch of stuff, and then like hang out with friends and have a pizza party and stuff. I think I'd take them skydiving because I've never been, and the anxiety would drive me nuts, and I know Riley would go screaming low, but it'd be like, you don't have to worry about being low anymore, jump.
Take all of their diabetic supplies and have a really big fire at your parents' farm and burn it all.
I do rely on my teammates because they're reminding me and just having my back, I guess. Most of my teammates, they'll ask me every time I test, what's your number? Are you okay? Can you play? Or they'll ask me, can I poke you? And like, they just want to help me out in every way they can. JDRF is important to me because it reminds me that people actually care. People are like working towards it and like trying to help everyone out.
When Jessie was 4 and diagnosed with diabetes, I had a phone call from Barb at JDRF, and she gave me a mentor from JDRF, Melanie. That mentor and the other people at JDRF that I've come to know have been a support system like no other.
Everybody has the same goal, the same outcome, is to get rid of this.
A very worthwhile organization, JDRF. I hope you've learned from the PowerPoint, the slides. I hope that you will think about competing in pathophysiology. I think the information you gain will be very valuable as you attempt future endeavors. Thank you for your attention.